this is Dr. Rachel Kalin with LapBandDoctors.com. I want to talk to you a little bit today about portion size and about how to figure out what the right portion size is for somebody who is having a lap band meal. I think a lot of the confusion that I have sometimes when I'm talking to patients when they'll say, I'm eating too much, my portions are too big, when in fact I think their portions are pretty good. Sometimes that leads to patients being overfilled, meaning that they end up throwing up a lot and having complications from being overfilled, throwing up, having a potential for slip, sometimes even erosion. One of the tools that we use in our practice to make sure that we're talking to patients about the same volume when we're talking to them, not using words like too big or too small, but we try to standardize how much people are eating. The tool that we use in our practice is actually this plate. I call it the magical plate for a couple of different reasons. Number one, if you look at this plate, what you'll notice is the center of the plate, the part that has the blue circle within it, is pretty much what we consider an ideal portion size. It's about the size of a salad plate, roughly speaking, cut into three different areas. The first and most important area, half of that salad plate size dish, is protein. We want to make sure that protein is the first thing that you eat, it's the main thing that you eat. Because you're eating smaller portions overall, you want to make sure in order to get adequate protein, that protein is about half the volume and half the calories of what you eat. The other two things about the plate that you'll notice in a slightly larger than half on the top side of the plate are no starch vegetables and fruits. That's going to be salads, vegetables, small amounts of low glycemic fruits, not grapes, not bananas, but different kinds of fruits, apples, pears, peaches. Carbohydrates are that little bitty corner up on the side. And that's going to be your rices, simple starches like potatoes, pastas. That's the proportion, and that's about the size meal that I expect somebody to eat 3 times a day. If you can eat that 3 times a day and not be hungry between meals, then your band is pretty well adjusted. I call it the magic plate because I say if you eat off of this plate 3 times a day and get up and walk away when you're finished with that meal, even if your head still feels hungry, if you get up and walk away 15 minutes later, if you're not hungry anymore, then what you were feeling was head hunger, not true stomach hunger. That's not the band that needs to be adjusted. That's more of a habit issue, getting up and walking away after a meal. The magic plate lets us say, okay, if you're still hungry after that, then you need an adjustment. If you're not still hungry after that, then you're eating about the right, then your band is adjusted to the right place to allow you to eat small meals and lose a lot of weight. Thank you for watching. This is again Dr. Rachel Kalin from LapBandDoctors.com.